Hello and welcome. I'm Tom Ebeyer, and today I'm joined by Dr. Adam Zeman to talk about aphantasia and mental imagery extremes. Dr. Zeman was trained in medicine at Oxford University Medical School after a first degree in philosophy and psychology. He's been a neurologist in Edinburgh from 1996 and has been a professor of neurology at Exeter University Medical School since 2005. His clinical work specializes in cognitive and behavioral neurology, and in 2015 published Lives Without Imagery, Congenital Aphantasia. Adam has been instrumental to the life discoveries so many aphantasics have made all around the world, myself included. Please welcome Dr. Adam Zeman.
Hello, thanks very much for having me.
Thanks for joining us. How are you doing today?
Yeah. Bit rainy in Edinburgh, but all good otherwise.
Great, I appreciate it. Well, okay, we've got a lot of questions and comments from our members all around the world, and let's get started. So let's start easy. Tell us how you discovered aphantasia.
Yeah, well, it's a longish story. It was really a rediscovery rather than a discovery, but I'll tell you the tale. So I first met someone who couldn't visualize in 2003. This was a patient who was referred to me because of abrupt loss of the ability to visualize. A man in his mid-60s, very articulate, very good experimental subject. We worked with him for a while and found a quite neat neural correlate for his loss of imagery. So when you or I, if you have imagery, visualize, we activate visual regions of the brain. It turned out that when MX, the patient, looked at famous faces, he activated visual areas of the brain quite normally, but when he tried to visualize them, he failed to. So this was a neat neural correlate for his loss of imagery. And we described his case as one of blind imagination. The reason for choosing that phrase was that he could answer questions which you might have thought would require imagination, like, is the green of grass darker than the green of a pine tree? But nevertheless, he didn't visualize while doing so. Our description of his case got picked up by the American science journalist Carl Zimmer in Discover magazine, and over the next few years, I was contacted by about 20 people, Tom one of them, who said, we're just like MX, but we always have been. We've never been able to visualize. I've always been aware that there's this quirk in my psychological nature that when other people reminisce, they seem to have an experience that's a bit visual, but I can't. And we felt that this phenomenon deserved a kind of catchy name because the terms in the literature were very unwieldy: defective revisualization and visual irreminiscence. So I consulted a classicist friend of mine who suggested that we borrow Aristotle's term for the mind's eye, phantasia, and tag an A on at the end. So that was how aphantasia was born. And we published that description of, I think, 21 cases of people with lifelong lack of a mind's eye in 2015.
Yeah, that's great. And so many more than 20. No,
so many more than 20 now. So since then, I've been contacted by about 15,000.
Yeah, wow. That's great. Okay. What is hyperphantasia?
Yeah, so the story began with aphantasia. That was how my interest was captured. Once the aphantasia term got out into the world and people became interested in this topic, we began to hear from people who would tell us, I also think I'm a little unusual, but I'm unusual in the opposite sense to the way in which most of the people who've been contacting you are unusual. I have extremely vivid imagery which is as vivid as real seeing. Some such folk would say, for example, that it was really quite hard for them to be sure whether they had imagined something, whether it had actually happened, because what took place in their imagination was pretty much as vivid as what took place in real life. So we became interested in this, in the opposite extreme of the vividness spectrum, and coined the term hyperphantasia to describe such folk. I should perhaps say that we have used in our work and continue to use a questionnaire called the Vividness of Visual Imagery Questionnaire, which I'm sure many of you know. So this is a questionnaire which invites people to rate the vividness of the image they conjure up when they try to visualize 16 scenarios, like the sun setting into a misty sky. And for each scenario, you rate your image from a score of 1, which means no image at all, just thinking about it, to a score of 5, which means as vivid as real seeing. So for the whole test, the score ranges between 16/80 and 80/80. So somebody with extreme aphantasia will have a score of 16. Somebody with extreme hyperphantasia will have a score of 80/80. We've included people who are just a little off those extremes. So I think in most of our work, we've described people with a score of between 16 and 23/80 as having aphantasia, and a score of between 75 and 80/80 as having hyperphantasia. There seem to be rather more people at the high end of the distribution. It's a little bit crowded up towards the top end.
Yeah, that's really interesting, and still as an aphantasic, just thinking about how, being able to imagine or visualize as vividly as seeing is even hard to wrap my mind around.
Yeah. I can't remember, Tom. Are you an aphantasic person who dreams visually?
I don't dream visually.
You don't?
No, very hard to explain. But yeah, we
So
I think we have some dream questions that we'll get to.
Okay, we'll come to that.
Can you talk about which parts of the brain are different in people with aphantasia?
Yeah. I think the most truthful, straightforward answer to that question would probably be to say that we don't yet know the answer to that. At least not in the case of the great majority of folk with aphantasia, people with lifelong aphantasia. What we found in MX, as I briefly explained at the beginning, was that he appeared not to activate visual areas of the brain when he tried to visualize, whereas people with imagery do. So perhaps turning the question around, I can explain something about what happens during visualization, and that might be a way into talking about which parts of the brain may be different between people with aphantasia, because we don't really yet know. So if I ask somebody to visualize an apple, a number of things have to happen in the mind and brain. So the person I'm asking has to understand the request, has to be able to process language. So there's likely to be some language-related activity involved in visualizing. Then you have to make the decision to do what you're being asked to do. So you have to, it's likely that you're going to activate decision-making areas in the brain, regions that tend to be called executive, areas that are involved in controlling thought. Then you're going to have to remember what an apple looks like. So there's going to be some activation of memory-related areas. And then it seems that in those who can visualize, what then happens is that there is an activation of visual areas. So there has to be a lot of sort of conversation in the brain between areas involved in language, areas involved in decision-making and attention, areas involved in memory, and areas involved in vision. Now, we have a little bit of evidence from a recent study that connections between visual areas and attentional and decision-making areas are weaker in people with aphantasia than in people with hyperphantasia. So one possibility is that there's a difference in connectivity in the brain. But there are other possibilities which we really need to explore further. So there's some evidence from Joel Pearson's team in Sydney. I think Joel did an AMA a few weeks ago. Joel's a well-known imagery researcher, and he has some evidence that the area of the primary visual cortex, that's the area at the back of the brain that receives visual information, may differ according to the strength of visual imagery. Strength is related to vividness, so it's not exactly the same thing. So connections may be important. The volume of certain areas may be important. There's a little bit of evidence that resting brain activity may be important. There's some evidence from other work, not looking at aphantasia and hyperphantasia, but at people who have less extreme variations in imagery. There's a little bit of evidence that activation of visual regions is relevant, as we found it was in MX's case. So there's a whole number of possibilities here to do with connectivity, areas, volume of brain areas, the level of activation in certain brain areas, and resting brain activation. And really more work needs to be done to discover the truth. And it may well be actually that all those factors are involved, because they're not mutually exclusive.
So it's not like a single thing that's defective that you can identify on a scan.
It doesn't at the moment look like a single thing, and maybe that triggers a thought which I should probably convey, which is that I don't think aphantasia is one thing. So I don't think it's a single mind-brain entity. I think it's a feature of experience that can occur in a number of different contexts. So there are some people with aphantasia who have trouble recognizing faces. There are some people who have rather poor autobiographical memory. There are some people with autistic spectrum disorder. I suspect these are distinct subgroups, and it's likely that there are going to be different neural bases, different things happening in the brain in those different subgroups. It's not surprising, because visualizing is a very complex process. So you might expect that it would vary for a number of different reasons, because of variations at different points in the brain network that's involved.
That's great. Thanks for that. Okay, Deanne Despris asks, I discovered aphantasia a couple months ago and found that both my parents, my brother, and I can't visualize things. Is this hereditary, or is it more common than believed?
So please get in touch, because I'd love to hear more. We do have evidence that aphantasia is familial. So last year we published a study based on 2,000 questionnaire data from 2,000 people with aphantasia, and it looks as if if you have aphantasia, the chances that your first-degree relatives will have aphantasia are raised by about tenfold. So clearly there's a familial clustering, and that may well have a genetic basis. Really interesting if both your parents are aphantasic. That's unusual. It's more often one parent and then a brother and perhaps a child. I think we're fairly clear that the frequency is around 1 to 3%, depending on how you define aphantasia. So if you only include people with that 16 over 80 score, it's about 1%. If you include people with a score of 16 to 23 over 80, it's about 3%. So I don't think it's going to prove to be very common, but I think it is quite likely that there will prove to be an underlying genetic story, probably a number of genes, and we're now in the process of trying to begin to hunt them down. So there are a number of large databases now around the world. 23andMe is an example. Organizations which have collected genetic data from large numbers of people and some associated psychological data. So we're hoping that we'll be able to use data from these large data banks to hunt down genes that may be involved in influencing imagery vividness. But I think the chances are that there will be some, though we haven't yet found them.
Great. Thank you for the question. Okay, let's see what comes up next here. So Ralph asks, is it due to aphantasia that I'm less triggered to remember traumatic memories and react accordingly?
I think very possibly so. So I'm sure we'll come on to discuss this further. I think aphantasia has a number of disadvantages and advantages. When they're probably balanced, and the same is true for hyperphantasia. One of the things that many people with aphantasia have told us is that they're less disturbed by images which others find distressing. So people have said that they can clear out the drain or do something which someone else might really not wish to do, partly because they know that they're going to remember it afterwards. People with aphantasia tend not to dwell on distressing images as those with imagery do. So that raises the possibility that aphantasia might be a little protective against PTSD, for example. And linked to that, there's a nice study which Joel Pearson, again, who I mentioned earlier in Sydney, a nice study that he was involved in recently, in which this is sort of tangentially relevant, but nevertheless I think it's worth mentioning. Folk with aphantasia were read stories which evoke, for most of us, distressing images. And most of us, when we hear those stories, tend to sweat a little. Our skin conductance rises. That wasn't the case for people with aphantasia. So I think returning to the question, which I'm straying from a little, I think the answer is yes. I think aphantasia is somewhat protective against prolonged traumatic reactions to memories of things that are likely to create distressing imagery in people who can visualize.
Yeah, I resonate with that myself. Let's go into the next one here from Maisie. What do we know about the impact of aphantasia on eyewitness testimony? More specifically, related to cognitive interview techniques that rely heavily on visualization to remember events.
Yeah. So again, the straightforward and honest answer is that we don't know much at the moment because it hasn't been specifically studied. We are beginning to learn some interesting things about memory and aphantasia generally. So we know that perhaps surprisingly, memory performance on standard memory tests isn't much or at all affected by aphantasia. So if you are read a story or a list of words, you're going to remember that as well as if you had imagery. Perhaps that's not surprising. But even if you're shown a complex design and then asked to reproduce that a few minutes later, people with aphantasia seem to do as well as those with imagery. That's a bit counterintuitive, isn't it? You might have thought that the lack of the ability to visualize would have an effect there, but it doesn't seem to. So basic verbal and visual memory seems to be intact. Where we are finding a difference is in what's called autobiographical memory. So this is the memory that you use when you're recollecting an episode from last year's summer holiday or the last party you went to or a wedding. People with aphantasia give less rich descriptions than people with imagery. But that's not to say that they necessarily give less accurate descriptions. And it could be that if you have vivid imagery, you're going to be at risk of elaborating your memories and introducing details which weren't actually present at the time. So I think it's really the question about eyewitness testimony is an open one. One might predict that people with aphantasia are going to supply a little less detail, but it's always possible that the detail they supply might actually be more accurate. And I should also say that there are some people with aphantasia who seem to have no trouble at all with autobiographical memory. So again, it's on average, autobiographical memory is less rich in aphantasia, but there are exceptions to that rule, which is probably again related to the heterogeneity of aphantasia, the fact that I think it's more than one thing.
Yeah. So just because you have aphantasia doesn't necessarily mean you have a bad memory, though there may be some relations.
Yeah. And if you do have a bad memory, it's probably only particular kinds of memory that are affected, particularly this autobiographical variety.
Great. Katie asks, is there research on how PTSD presents and can be treated in people with aphantasia? Can EMDR work?
Yeah, so this is a question that's coming up quite a bit, and it's something that I really hope to look into further with psychologists and psychiatrist colleagues. So I suggested earlier that aphantasia may be somewhat protective against PTSD. That would make intuitive sense because you're less likely, presumably, to be haunted by distressing imagery. But it can happen. So a number of people with aphantasia and PTSD have been in touch, and it does create some difficulties with standard therapy. So EMDR, eye movement desensitization reprocessing, I think, is a therapy in which people are brought back to the trauma which troubles them, and then work on it, and by moving their eyes and in other ways. And that bringing back in most folk involves revisualizing, and of course that isn't possible with aphantasia. But there are other ways of re-inhabiting the experience which can be used, and my understanding is that there are ways of adapting EMDR so that it can be helpful. So I think the answer is that it probably presents a little differently, but it can be treated. You would want to explain to your psychologist that you're aphantasic, and to make sure that the psychologist knows what that means. But I think it should be possible to adapt therapy.
That's great. Thanks for the question. Sophie asks, do you believe that aphantasia can be caused by emotional trauma? I had visuals and autobiographical at age 3, then nothing after that time. Total aphantasia of all senses.
Well, I'm glad that you asked that question, and I was wondering whether to touch on that in the answer to the last question. So really the question here is whether trauma can cause aphantasia. And this is something that's been raised repeatedly, often enough that I think it's a question that we need to take very seriously and investigate. And I apologize if in response to this and to quite a number of questions, I say that we can't honestly give a confident answer because the work hasn't yet been done. But certainly, quite a number of people have told me that they believe that their inability to visualize is related to trauma which has occurred in the past. And I guess the thought process is that perhaps if you are at risk of recollecting experiences which are extremely distressing to you, you might somehow learn to shut down visualization. That might be a strategy, a self-protective strategy, a way of keeping those distressing thoughts and memories and images at bay. And I think that's a very intriguing possibility. My primary training is as a neurologist rather than as a psychiatrist, so I'm slightly off my territory here, but I am in discussion with psychologists and psychiatrist colleagues about trying to answer exactly that question.
Great, thanks for the questions. Have you researched anyone with aphantasia whom has been able to regain visual imagery?
So it seems to be rare. I guess there's a distinction to draw here between lifelong aphantasia and acquired aphantasia. So most of the people who've been in touch, the great majority have lifelong aphantasia, and the great majority of people who've spoken about this have said that they've tried and failed to gain imagery. There are certainly situations in which people with lifelong aphantasia experience imagery, so during dreams. So about a little over half those we've asked with aphantasia do have visual dreams, which is intriguing. So people with lifelong aphantasia can experience imagery in that context, and sometimes when they're drifting off to sleep, hypnagogic imagery is sometimes present. And quite a lot of people have told us about their experience of psychedelics, and some people with aphantasia, not all of them, but some will experience imagery while under the influence of a psychedelic, but that doesn't seem to carry through into their normal lives. So it doesn't confer the ability to visualize at will. Quite a number of people have said that they've used various techniques they've come across to try to cultivate imagery, but they haven't succeeded. So that's the story with lifelong aphantasia. Seems to be that it's pretty hard, I think, to gain the ability to visualize. Acquired aphantasia is loss of the mind's eye occurring in someone who has previously been able to visualize, and that comes in a few flavors. So it can be due to brain damage. If you have a stroke or if you have a head injury, then that might rob you of the ability to visualize. But there is a group of people who seem to lose imagery for psychological or psychiatric reasons, so because of depression, for example, or depersonalization syndrome. And people who lose visualization for those reasons are perhaps the most likely to regain it if that psychological disorder can be successfully treated or resolved. So a slightly complicated answer.
I spent many nights trying to conjure images without much success myself.
Yeah.
Thanks for those questions. Are there any medical conditions that make someone more likely to have aphantasia?
So depends a little bit on what you call a medical condition. Thinking of the lifelong folk, we know that prosopagnosia, so that's difficulty in recognizing faces, is associated with aphantasia. So that's one condition, if you wish to call it so, that seems to raise the risk. It's probably the case that autistic spectrum disorder raises the risk. There seems to be an association there. Then there are some associations I'm a little less sure of, and that haven't really been formally studied yet. So ADHD, attention deficit hyperactivity disorder, quite a number of people with ADHD and aphantasia have been in touch, making me think that there might be a link there. And that wouldn't be surprising because neurodevelopmental problems like autistic spectrum disorder ADHD often co-occur, and I don't really think of aphantasia as a disorder, but it's clearly a kind of lifelong variation in experience, which is likely to have a neural basis. So it could be, one could include it. It wouldn't be surprising if it kind of belonged in that group. Dyslexia is another possible association, which a number of people have asked about, but which again I don't really feel confident about yet. So I guess prosopagnosia and autistic spectrum disorder are the clearest examples. So that's in the lifelong group, and then in the acquired group, so acquired aphantasia is really due to the occurrence of a medical disorder during life in someone who previously had imagery and loses it as a result. And as I've said, there are neurological causes, so head injury, stroke, meningitis. And there are psychiatric causes, which include depression, depersonalization, occasionally psychosis. So yeah, there are some examples, but the majority of people with lifelong aphantasia don't have any other underlying medical disorders, so far as we know.
Great. Can aphants be hypnotized?
Again, I'm replying from anecdote, and the anecdote suggests that it's probably a bit harder to hypnotize people with aphantasia than the average. And in fact, a hypnotist emailed me just a couple of days ago to say that she'd like to study exactly this. Yeah, there may be aphantasics may be relatively resistant to hypnosis, maybe a bit less suggestible than most of us. Could be one of the advantages, possibly.
I've never tried, but you can sign me up. That would be fun. What are the connections between aphantasia and SDAM?
Okay, so SDAM is severely deficient autobiographical memory syndrome, which is a syndrome that was described by a Canadian psychologist who works in Toronto, Brian Levine, and his colleagues at about the same time as aphantasia. It was originally described in a small group, I think just 3 participants, though I know that Brian has heard from a very much larger number of people over the years since then. And people with SDAM lead, they're healthy, they're leading normal lives, but they have a very, very thin recollection for their autobiographical past, and are normal in other respects. So the question arises whether there is an overlap between aphantasia and SDAM, and I think there almost certainly is. So I know of at least one person who, in fact, one of the 3 people in that original series who has both aphantasia and SDAM. And some of the people who've been in touch with us, and some of those we've studied with aphantasia, have memory difficulties of the kind that would fall in the SDAM range. But I don't think they're identical. As I mentioned earlier, there are people with aphantasia who seem to have pretty good memory across the board, including autobiographical memory. And I don't think we know yet that everyone with SDAM has aphantasia. So clearly everyone with SDAM is going to have problems with visualizing events from their past, but I'm not clear yet that everyone with SDAM would have difficulty in visualizing an apple. So there's a distinction in psychology between semantic memory and episodic memory. Semantic memory is your kind of database of knowledge about the world and about language, whereas episodic memory is your memory for single events. Clearly, people with SDAM have a poor episodic memory and are unable to visualize episodes from the past. What I'm not so clear about is that people with SDAM will invariably be unable to visualize items in their semantic memory, like apples and tables and front doors. So I think there's an interesting overlap between the two. My hunch at the moment is that they are not, however, identical.
Great. Thanks for that explanation. Okay. What can you tell us about how prevalent aphantasia is in ADHD and autism?
So again, I'm not sure that I can really give you a proper prevalence figure. In fact, I can't give you a proper prevalence figure because there hasn't been the right kind of study hasn't been done. There hasn't been an unbiased study in a large population of people with autism or with ADHD to answer that question. But it does seem that there is an association between autism, certainly, and aphantasia. So that's come to light in a number of ways. First of all, quite a number of the people who got in touch with us have got in touch with us. A number of the 15,000 people or so who've been in touch over the last 5 years have said that they have Asperger's syndrome or are on the autistic spectrum. So there's sort of strong anecdotal evidence of a link. Recently, a student who was working with me and is now doing a PhD in Sussex, Carla Dance, has published a study showing that the frequency of autistic spectrum traits or features is raised in aphantasia. So there's evidence for association, and I'm doing some further work looking at that. So it looks as if there is a true association between autism and aphantasia, which is not to say either that everyone with aphantasia has autism or that everyone with autism has aphantasia. And indeed, there are some people with autism who seem to have rather vivid imagery. So I think it's not a simple relationship; it's a rather complex one. But there is an association there. If you have autism, you're a little more likely to be aphantasic than otherwise, and vice versa. ADHD, I'm just not sure about yet. Anecdotally, quite a number of people have reported that they have both. So again, that sort of makes my ears prick up. I think there may well be a link. I've mentioned that neurodevelopmental disorders quite often co-occur, associate with one another, but there hasn't been a formal study of the ADHD aphantasia link yet, and there certainly isn't, so far as I know, anyone who could give a figure for the prevalence.
Yeah, that just highlights there's still so much work to be done, so much left to discover. So a number of the questions come up against that same thing is we just don't know, and I think that's fine. That highlights the opportunity in the field.
Yeah, it's a very young subject.
Yeah, absolutely. What are the connections between aphantasia and early onset Alzheimer's and/or dementia? Has there been any research into this?
So there hasn't been any very formal research into this yet. I've talked a little bit about acquired aphantasia, people who lose the ability to visualize in their lifetime, having previously had it. There are rare case reports of people in whom loss of imagery is an early feature of a neurodegenerative disorder of something like Alzheimer's, and we have a few folk in that category in our group of people with acquired aphantasia, because although most of those who've been in touch with me have lifelong, there have been people who've described the loss of imagery. So I think it can occasionally, I don't want to worry people because I think this is rare, but I think it can occasionally be a symptom of such a disorder if it develops late in the course of life. I'm not aware, looking at it the other way around, if you have lifelong aphantasia, does that influence your risk of dementia? I don't know of any evidence either way on that yet.
Great. Do you know of any emerging behavioral differences in aphantasics or hyperphantasics?
Okay. So I think we're learning a little, but it's sort of impressionistic rather than scientific so far. Many people with aphantasia have told us that they reckon they're a little better at moving on than their friends and relations who have imagery, particularly vivid imagery. And it would make intuitive sense if aphantasia allowed people to be a little more present than those of us who are constantly longing for the past we are imagining, or anticipating the future that we're imagining. So it's possible that sort of aphantasia gives you for free what many people seek through mindfulness. So a certain measure of presentness and sort of detachment from the thoughts and images which can be a delight, but can also plague people when they find themselves ruminating on the past, or becoming preoccupied with thoughts about the future. You might predict that lack of imagery could also be protective against some disorders which are driven by imagery, like addiction. So we know that imagery is quite important in fueling addiction. So possibly aphantasia would protect against that. What about the opposite end of the spectrum? Well, we know, and I should have mentioned this in the context of aphantasia, but this is relevant to both extremes of the spectrum. We know that there's some link to occupation. So people with aphantasia are a little more likely to be working in the sciences, whereas people with hyperphantasia are a little bit more likely to be working in what are traditionally regarded as creative industries. So this may relate to a tendency for people with aphantasia to be more abstract thinkers, and people with aphantasia to be more sensory thinkers. So where have we got to? I've said that I think aphantasia makes for presentness. We know that it makes you be a little bit more likely to be a scientist. People with hyperphantasia perhaps are more at risk of emotions that are linked to imagery, and a little more likely to work in creative areas, though there are exceptions to these rules. These are only average tendencies. So one of the really nice surprises in the course of our research was the discovery that, or contact from, quite a large number of aphantasic artists. So I think I and my colleagues in the Eyes Mind group, our original research group, had assumed that people with aphantasia probably wouldn't be that interested in the visual world. But it turns out that that's not the case. There's a great number of, I now have more than 100 aphantasic artists tucked away in a folder. And indeed, it's possible that aphantasia may actually, in some cases at least, promote an interest in the visual world. So the generalization that aphantasia travels with science and hyperphantasia travels with art is just that. It's generalization. It's certainly not true by any means across the board. And that reminds me to say also that I don't think aphantasia implies a lack of imagination. So there are many ways of representing things in their absence other than through visual imagery. So people with aphantasia can be perfectly imaginative. So there, I've thrown out a few behavioral contrasts, and as with so many of the other questions, I'm afraid we need to do more to investigate these contrasts further.
Yeah, that's great. But some good generalizations, and just like you, we've seen aphantasic artists, hyperphantasic artists. It's so much of it is interest driven and determination to maybe find alternate strategies. That's someone who was visualizing.
That's right. I mean, that's worth saying, isn't it? That I think visualization is fascinating, but it's one small piece in a much bigger jigsaw that is a person's psychological makeup. So it'll have an influence, but it's only one among many variables, many influences that determine what kinds of people we are and what kinds of things we're interested in.
Exactly. So for any aphantasic artists out there dreaming of becoming a creative or whatever, don't give up because of the aphantasia.
Yeah.
Are there demographic differences in the prevalence of aphantasia?
So I guess that means demographic differences between different populations in different parts of the world, maybe socioeconomic differences. I'm afraid we just don't know. So what I can say is that I've been contacted by people from all around the world. So I don't think that's certainly from every continent. So it's clearly not restricted to any particular location, but there haven't yet been any serious comparative studies, so far as I know. The figures which I've given, the 1% for 16 over 80, 2 to 3% for 80 over 80, those figures come from Exeter, which is where I've been based recently, where there is a local community biobank, and we surveyed members of that biobank, and those data come from about 1,200 people in the biobank.
Yeah, and at the network here, we've heard from people all over the world, from Korea to Madagascar to California. You know, really, it really is a global phenomenon.
Yeah. I've had quite a few emails which are entirely in Chinese. It's great to get emails from China, but the ones that come entirely in Chinese are difficult for me.
Yeah. So very interesting. Thanks for the question, Eddie. Is there anything that's been done on gender or cultural differences within aphantasia?
Okay. So it's a nice story. I think all but one of the original 21 folk who got in touch with me were male. So that suggested a bit of a sex difference. But of course, by definition, the people who got in touch, who were all people who'd read Discover magazine, had particular interests and backgrounds. So it seemed possible that the overrepresentation of men might reflect the readership of Discover. So since then, we've been able to look at this much larger group. And in our study of 2,000 people with aphantasia and 200 with hyperphantasia, we found no sex difference among those with aphantasia, but a female predominance, I think roughly 3 to 2, among those with hyperphantasia. So that suggested that the original impression that aphantasic was a kind of male preserve had been very misleading, and clearly there are plenty of aphantasic women about. But we don't yet have a figure that one can really trust. It may be, for example, that women are more likely to get in touch, are more communicative. So it could be that there is in fact a male predominance in aphantasia, and that the figure in our group of 2,000 was biased by the fact that women with aphantasia are a bit more likely to talk about it, to communicate, to let us know. But clearly there isn't a huge sex difference, but it could still be that there's a female predominance, and it could be that our impression that there are more hyperphantasic women is misleading for the same reason. But I guess the take-home message from last year's paper, where we looked at 2,000 people with aphantasia, 200 with hyperphantasia, is that there aren't huge sex differences either way. My suspicion would be that there may be a modest male predominance in aphantasia and a modest female predominance in hyperphantasia. And actually, that would fit with the means of the VVIQ in men and women. So the mean VVIQ in women is slightly higher than in men. Then cultural differences, I guess I think I've said all I can about that, which is the link between aphantasia and science, and the link between hyperphantasia and creative industries.
Awesome. How can you tell the difference between normal phantasia and hyperphantasia? I can see, feel, manipulate, smell, hear, and taste my mental imagery, but compared to seeing right out of my eyes, it's not the same.
Yeah. Well, so this touches on a very general question, doesn't it? Which is how can we be sure how our experience compares with that of others? We can't climb inside other people's heads. We can't inhabit their minds. So it's not straightforward. But I guess the most straightforward answer is that the VVIQ gives you the opportunity to describe your imagery as being as vivid as real seeing. And there is a group of people who say that it is. And my instinct is sort of more or less to trust them, at least as a starting point. So I guess the implication from the question was that your imagery, like mine, has sensory qualities, but it's not quite like seeing or hearing or smelling or tasting the real thing. That's true for most of us. So most of us have imagery which feels a bit like the stimulus which we're in the real world, which we're imagining, but is a kind of echo of it. So imagery is often described as a kind of weak perception. That's how it is for most of us. There is this group of people who say it's as vivid as real seeing, and I think the differences which are beginning to emerge in neuropsychology, so the differences in autobiographical memory and imagination, for example, and the differences which we're beginning to see in brain scanning, and the associations with different groups of psychological phenomena and disorders, those all support the validity of introspection, if you like. It does seem that people who say that they have nothing happening in their mind's eye and people who say that their mind's eye is just as vivid as real seeing, they do seem to be recognizing something distinctive in themselves which associates with other characteristics. So I'm a believer in introspection. Introspection gets a hard time in psychology, and of course we can be wrong about ourselves. There's no question about that. But I think it's not a bad place to start when you're investigating the mind and brain.
Great. What are the advantages and disadvantages of knowing that you have aphantasia?
Yeah. So some people have described distress when they realize that they lack an ability which others have. And I think probably the single thing which people have found most distressful is not being able to visualize faces of friends and family, particularly people who they've lost. But of course, that's the situation whether you know that you have aphantasia or not. But as I say, some people with aphantasia have said that it's distressing for them to have come to realize that they lack an ability which others have. But the level of distress is usually pretty low, actually. So by and large, people with aphantasia are interested to make this discovery about themselves. Quite often, people are delighted to have a description which they can use in conversation with others, and are glad that a bit of scientific light is being shone on this. What are the advantages? Well, I guess it's probably generally helpful for us to know ourselves, to understand ourselves. People with aphantasia who've come to realize that they have aphantasia quite often say that it helps to explain things which in the past they'd found puzzling. So people will often say that they'd assumed up till now that when others speak about imagery, they're speaking metaphorically, they're just using a figure of speech. It's quite helpful to realize that actually people are describing a feature of their experience which is just a little different to that of the person with aphantasia. So I think it confers some self-knowledge which most people seem to find interesting, useful. It helps to explain things that in the past have been puzzling. Maybe helps to explain a little about behaviors which may have been slightly different to the norm, but which now makes sense in terms of the diagnosis. As I mentioned, there can be an element of disappointment, but it isn't usually too great. I guess there's a risk of over-interpreting. So if you inferred from the fact that you have aphantasia that you are not imaginative, or that you can't enjoy art, or you can't be an artist, then that would be a mistake, an understandable mistake. But I guess there's always a risk of over-interpreting and assuming that this diagnosis is going to be more of a problem for you than it actually is. So I guess it's helpful to once people have made the discovery to learn a bit more about it and realize that it's not a disorder. It's an intriguing variation in experience, has its pluses, has its minuses, and it's certainly no bar to leading a fulfilling, productive, creative, imaginative life. One other thing to mention, so some people, because a lot of people have been in touch, some people who've been in touch have been very distressed. But my sense has generally been that the distress actually doesn't flow from the aphantasia. There are other things going on, causing distress in those folks' lives. So I think somebody who's very distressed shouldn't attribute that to the aphantasia and should do the things which we all do when we're unhappy and need help. Talk to friends, family, go to see a doctor if necessary, because there's probably something else going on.
Yeah, for me, the language, the discovery just helped me talk to other people about it, and make realizations about my own life, and gives you common language, and very intriguing to realize that there are these big invisible differences, in our internal lives between person to person, and most of us don't talk about those invisible differences.
Yeah, absolutely.
In aphants, is there activity in the visual cortex when presented with a visual cue?
So I guess the question is, if you're asked to visualize something, if somebody says, try and think about or visualize a tree, does that cause activity in visual cortex? I assume that's the question. If the question is, when you're looking at a tree, if you're aphantasic, do you have activity in visual cortex? The answer is a very, very straightforward yes. So there doesn't seem to be any difference between activity in the brain during vision, during perception, in people with aphantasia compared to people with average imagery or with hyperphantasia. But there do seem to be differences in brain activity during visualization. And so I began talking about this right at the beginning, but it's a fascinating question, and so it's a good one to come back to. We don't for sure yet know what the differences are, particularly in people with lifelong aphantasia. There have been a number of studies over the last 20 years or so looking at the neural correlates of vividness. So this isn't looking at people with aphantasia and hyperphantasia generally, it's looking at people with mid-range variations, so people who have more vivid or less vivid imagery rather than people who have very vivid imagery or lack it altogether. But if you compare the people with vivid versus people with faint imagery, the differences most often seen lie in not the primary visual cortex, not the place where information first arrives, but visual cortices which are downstream. So that maybe needs a little bit of explanation. When you look at the world through your eyes, information flows into the brain and it ends up in the primary visual cortex right at the back of the brain, where there is a map of the visual world. So the left visual cortex maps the right side of space, the right visual cortex maps the left side of space. But actually about half the brain is visual, and there are another 30 to 40 visual areas which are downstream, so the primary visual cortex sends information to them. And those areas seem to be involved in visual processing. So for example, there's one area which is particularly important in recognizing faces. There's an area which is particularly important in analyzing color. There's an area which is particularly important in analyzing motion. Now, the most consistent differences between aphantasia and hyperphantasia seem to be in those downstream visual areas. I'm sorry, I shouldn't have said hyperphantasia and aphantasia. I should have said people with more vivid and less vivid imagery. So this is mid-range. So there is evidence that if you are a vivid imager, you will have stronger activation of those visual cortices during imagery than if you're a faint imager. And another way of putting that is that if you're a vivid imager, what happens when you visualize is going to be more similar in the brain to what happens when you see than in somebody with faint imagery. There's also a bit of evidence that some areas of what's been called the default mode network are more active in people with vivid than in people with faint imagery. Default mode network areas are areas of the brain that are particularly active when we just rest. When we rest, we tend to be mind-wandering, daydreaming, thinking about the past, anticipating the future. So those areas, higher visual areas and some default mode network areas are the ones which appear to be more active in people with vivid as opposed to faint imagery. In the hyperphantasia aphantasia contrast, we just don't yet really know. So I mentioned the evidence from our recent study that people with hyperphantasia have stronger connections between the front of the brain and visual areas at rest, stronger connections between attentional and decision-making areas and visual areas when they're just at rest, when they're chilling in the resting brain. In our recent study, we didn't find a straightforward difference in brain activity between hyperphantasics and aphantasics during visualization. So that was a kind of disappointment and a surprise. And we're going to have to do some more focused analyses and to look again. We were using a relatively low-powered scanner, so it may be that our technique wasn't sensitive enough to pick up differences which will turn out to be there. So sorry for a long answer. This is very much work in progress.
Great. Okay, I think we have time maybe for one more question. Can you talk about what causes people also to not imagine touch, taste, and sound in the brain? The
Okay,
multi-sensory imagery.
Yeah. So this is a really nice question. So when I began on this road, I was focused on visual imagery and fascinated that there seemed to be people who couldn't visualize, but it fairly soon became clear that quite a number of those who couldn't visualize also lacked a mind's ear and a mind's fingertip and a mind's tongue. This varies. So there are people like Oliver Sacks, the great neurologist, who seemed just to have visual aphantasia. And then there are people like Blake Ross, Silicon Valley entrepreneur, who wrote a very entertaining Facebook post, who seems to lack sensory imagery across the board. So my prediction is that there are going to be some factors which influence imagery generally, and then there are going to be some factors which influence imagery in particular sense modalities. So that would make sense of the fact that there are some people whose aphantasia seems to be focal, it seems to be limited to one sense modality, and there are others in whom it seems to be present across the board. So again, I'm afraid this reflects the fact that imagery is generally a complex process in the brain. It's going to be influenced by a number of different variables, and I think some of them will affect all the senses, and others will affect just one.
Yeah, I find myself in that group with no imagery in any of the senses, and yeah, that's great. I don't know if we have any more. I think we're going to wrap it up there. So thank you so much for spending the time with us and answering all of these questions. There's a whole bunch of questions we weren't able to get to, but we couldn't get to them all, but that just means we'll have to do something like this again. The conversation continues at aphantasic.com. So if you'd like to see more from Dr. Adam Zeman, he'll also be a keynote speaker at the Extreme Imagination Conference this fall. So tickets are currently 50% off and can be purchased at extremeImagination.com. Be sure to check it out. And if you'd like to get interested in the Aphantasia community, you can head over to aphantasia.com/get involved. If you're on YouTube, please hit that subscribe button for more Aphantasia content. And until next time, I'm Tom Ebeyer. Thank you very much, Adam.
Thanks very much. That was enjoyable.
Thank you. Bye-bye.